experts here, and we'll spend about 10 minutes taking questions. Today you're going to hear from Dr. Bob Lutz, Spokane County Health Officer with the Spokane Regional Health District, Peg Curry, who is Chief Executive Officer for Providence Sacred Heart Medical Center and Children's Hospital, and Krista Arganchona, Sacred Heart Program Manager for the hospital's Special Pathogens Unit, and finally, you'll also be hearing from Dr. Dean Martz, Chief Medical Officer for Providence Sacred Heart. With that, I'm going to turn it over to Dr. Lutz.
Well, thank you, and good afternoon. Hopefully you can all hear me. Hopefully the volume is good. Okay. So,
you can just put it, yeah.
cue off of me, not. Well, again, good afternoon. The U.S. Department of Health and Human Services has asked Providence Sacred Heart Medical Center to monitor and care for 4 U.S. citizens who have tested positive for the 2019 novel coronavirus, also known as COVID-19, who are part of repatriation efforts. Providence is working closely with the CDC, the Washington State Department of Health, and Spokane Regional Health District to care for these individuals while they are under isolation. Sacred Heart was picked to receive these COVID-19 positive patients because of its secured airborne infection isolation rooms, a specialized unit within the hospital. Sacred Heart is one of 10 hospitals in the country with this specialized treatment center. The Special Pathogens Unit has been training and preparing extensively for this type of incident since 2014. The 4 individuals being transported today from Travis Air Force Base in Sacramento, California to Spokane International Airport. 2 of the 4 arrived earlier this morning, and a second flight will bring the remaining individuals this afternoon. We have been working with local partners to safely transport these individuals to the hospital's secure airborne infection isolation unit. This is being done by following a jointly developed infectious disease protocol that we have been training for and prepared for. I'd like to thank the partners involved in the safe transportation of these individuals. Spokane International Airport, represented by Chief Millsap here today. American Medical Response Transport, represented by Tamara Drapo. The Spokane Police and Fire Departments, here again represented today by Mike Lopez. And of course, our partners at Providence Sacred Heart. And of course, also the emergency medical teams that work daily in our community to ensure our community's safety. And also want to mention Brian Coddington, who's here representing the city of Spokane. Because of the well-practiced processes, this is a controlled situation. I emphasize this is a controlled situation. There is no risk to the residents of Spokane County by bringing these individuals into our community for care. In general, however, the risk to the general public of the novel coronavirus, of COVID-19, remains very low. With respect to the coronavirus itself, we are still learning the details about how this new coronavirus spreads. We know that other coronaviruses that have been seen in the past spread from an infected person to others through primarily respiratory. This particular pathogen was first discovered in China, in the Wuhan area, in December. And since that time, we have seen literally tens of thousands of individuals infected. As of today, I will tell you that on a site, there were 75,778 individuals who have been diagnosed with that, of which we have 2,130 deaths, which is significantly less than what we've seen with other coronaviruses such as MERS and SARS. So with that, I'm going to turn it over to Peg Curry, who is our Chief Executive here at Providence, to talk more about the Providence situation. Thank you.
Thank you. Thank you, Dr. Lutz, and welcome to our auditorium here today. I think one of the biggest questions you probably have is why here at Sacred Heart? Why our community? And as Dr. Lutz mentioned, in 2014, it was really evidence that the country really needed to strengthen the strategy to care for either unusual pathogens or viruses or new ones that emerged. So Sacred Heart was designated as a regional treatment facility, one of 10 throughout the country. Well, why were we picked? We were chosen because of our capability, our infrastructure, the staff competencies, and our ability to respond in 2015 when things were happening over in Africa with the Ebola virus. So I'm here to tell you that we are very confident, the staff's very competent, we are well prepared to deal with this particular situation here with the new coronavirus. I'm confident in our team members, I'm confident in our physician providers that we have the ability to safely care for these patients as well as our community. Our special pathogens unit is in an area separate from our main facility where we house most of our other patients. So we have special filtration systems that keep our air handling there separate, and patients who are in our facilities now can feel safe. We are operating normally. We are accepting patients. Any procedures that were scheduled are going forward as planned. You may feel safe here. I'm very encouraged, and I think the community can be proud of the fact that we have been designated as one of these regional treatment facilities. Being prepared is a much better opportunity for us to care for our community competently and carefully. So I'd like to introduce you to our manager of our special pathogens unit. Her name is Krista Arganchona.
Thank you, Peg. Good afternoon. I would like to confirm the fact that we have received 2 patients that are confirmed with the coronavirus into our unit safely. They are in stable condition. I want to emphasize the fact that we have a specialized unit and a specialized team that trains and drills regularly to safely care for patients in situations just as these. We are confident in our processes that provide safe care not only to our patients, but also provide safety to our healthcare workers and to our community at large. We have the expertise for this capability, and when Health and Human Services reached out to us asking if we would be willing to accept these patients, we readily accepted. So we are privileged to partner with our local partners, our community partners, our regional and our federal partners to do our part as our country works to contain this virus. We are part of a regional network that we collaborate with, and we're also part of a national network that we collaborate with regularly. And we have been in close contact with many of our partners since this coronavirus first emerged in China. So with that, I guess I just want to reemphasize the fact that our team is a specialized trained team. We have trained and exercised regularly for the last 4 years. We train in our unit. We train towards the scenario just as played out earlier today of the transport. So these practices are things we do all the time. And as I mentioned before, we practice with our local partners to go through these scenarios. So we are confident in our training, and that's why we've been training 4 years to provide this capability. So with that being said, I'm going to hand the microphone off to Dr. Dean Marks, our Chief Medical Officer.
Afternoon, everyone. I'll just reiterate 2 points. The first made by Krista is that we are part of a larger group that's taking care of these patients. This gives us the benefit of learning from other people's experiences and enhancing the work that we're doing here. The second is this is a respiratory infection, and part of working in a hospital in this time of year is taking care of respiratory infections. That means taking adequate precautions that we don't spread these infections to other patients on a unit or as caregivers contract them ourselves. In addition to the normal precautions that we're all very accustomed to taking, we are going to be caring for this particular group of people in an even more protected isolation facility, and that is good for them and good for our caregivers and the people in Spokane as well.
Thank you. With that, we'll open up the conversation to your questions.
Yeah, so what level of PPE do the people going into the rooms have to wear? Are these full body suits, or is it just essentially covering, potential sites like mouth and ears and things like that?
So,
Sorry, go ahead. And if I could just add on to that real quick. On the little handout, it says we have 10 units available, and that this includes critical care units. So how many would we be able to handle before we would have to potentially bleed over into other departments? And are they able to also successfully quarantine as much as this potential isolation unit is?
okay, let me start with the first question. The level of PPE we're wearing is in alignment with the guidance that the CDC has put out for caring for these patients. So that includes airborne protection, mucous membrane protection, and contact precautions. So that translates into a fluid impermeable gown, gloves, and a N95 filtration mask with a face shield. Or we also have what's called a PAPR, a powered air purifying respirator. That's what we wear for PPE.
Awesome. Thank you.
And could you, so your second question was related to the level of acuity of patients. So yes, we do provide critical care capability. As far as how many patients we could have,
Yeah, so I mean, I think that this morning they said that there's 15 confirmed cases in the U.S. So up to now we've gotten a third of those, and we're waiting to confirm 52 more pending. So how many more potentially would we receive? And since we can only handle 10 in this unit, would we have to expand to other parts of the hospital?
we certainly could. I think this is the management of the patients throughout the country will be continually reassessed, and we would do a risk assessment in the moment to decide if we were requested to receive more patients. We would make a very thoughtful decisions with all of our providers and with our partners based on level of acuity and what we feel we could safely provide.
I'd just like to add to that. There are 9 other regional treatment centers in the country. So Krista and our Department of Health and our local health district partners, we work all together to determine what's the best site for placement of these patients. So just because they might be West Coast currently, it doesn't mean that they'll all come to West Coast facilities. There's 9 other regional treatment centers that potentially those patients could go to. You're welcome.
And then you had a question here.
Yeah, I'm wondering, can you give us more details on the patients? You said 2 that are here in stable condition. Can you tell us more about that? The 2 that are coming, what condition they're in, where they're from?
I cannot tell you any more details. What I have is that the 2 that have arrived are in stable condition.
You can't tell us the condition of the 2 that are coming?
No.
No, okay.
Yes, here.
Peg, you said there were 9 other treatment centers.
Mm-hmm.
Why are we taking on 33% of the confirmed cases right now?
So first of all, right now we've been asked to receive 4. So 33% versus 4 is a little bit of a different number. The decisions are a cooperative and a collaborative decision between our Department of Health, between our federal authorities, our local district, and what we agree to in terms of our ability to care for patients safely. So we know that other centers have accepted patients as well, and certainly are being tapped for this going forward.
But why not keep all 15 in one location? Why split them up into different parts of the country?
Do you want to talk about size and location of the
Yeah.
other centers?
Those decisions are made at the federal level with CDC collaborating with our Health and Human Service partners, assessing what's the safest place, the shortest distance, and there's a lot of factors that go into that, but it's really a collaborative decision based on our level of capability and what they asked us to do. Does that answer your question?
Bed capacity at each of the centers plays into it too?
Yes.
My question is about treatment and care. Are you coordinating treatment with what the patient in Snohomish County received at the Everett Medical Center? And how does that process work for patients if they're consenting to receive drugs that perhaps aren't on the market legally?
So we are collaborating with our physicians, and then we have a research department that if it deemed necessary, we would explore all opportunities for providing whatever level of therapeutics that we could. I don't have any knowledge of the patient in Everett.
Do we
Yes.
know what other centers have received patients, the other 9 in the nation?
I can confirm that University of Nebraska Medical Center in
The
Omaha has
most
received
fun I have on
patients.
Daily Blast Live are actually the times where I forget I'm on
Can you
television
explain the
and someone
process
has to
when
say,
they-
okay,
what
you
does
guys need to
treatment
wrap it
look
up.
like
It's like,
once
oh, we're
they
not
get
just
here?
sitting around like
How
at
are
my
they cared
house.
for,
So those are the best
and what are
moments
those
when we're
steps? What does
just
that
being
look like?
us.
The treatment and care that we provide is
Chief of
the
Police.
treatment and care we
I am
provide.
just here to listen.
Women talk and
We assess them and provide the level of care that they
Nobody
need
believes them.
based on the expertise of the physicians and the nurses providing the care.
It's in your blood, it's in your bones. I never wanted to be a symbol, but you are.
Yes, this is the first time we have used our unit. This is, we have, as I mentioned earlier, we have practiced and trained in our unit, going through all these processes many times.
And an effective mayor, leadership that makes a difference.
He's been a leader throughout the country for the past 12 years. Mr. Michael Bloomberg is here.
Together, they work to combat gun violence and again to improve education for every child.
I want to thank the mayor of this great city, Mayor Bloomberg, for his extraordinary leadership.
Trains at least quarterly with me, so we have regular contact, and we have developed our standard operating procedures based on evidence and collaborating with our national partners. And so that team is regularly engaged in all of these processes. And then our staffing model is like our staffing model in the hospital, based on what's safest for the patient and what's safest for our healthcare workers.
So the doctors and nurses and medical staff that are going to be with these patients, while they're here, they're working exclusively, I know they're assigned to other roles when this isn't happening, so they're working exclusively with these patients right now?
They are working in the unit, right, when they're on shift working in the unit, they are exclusively taking care of those patients. But we are confident in our practices, in our personal protective equipment, that they are completely safe to go in there.
So it's not like they treat one patient and then they go about and do another patient in another ward or anything, like they're sterilized, I guess, or is that?
No.
And I know Bob mentioned that risk to the public is low, but there are very concerned people all around town. What would you kind of have to say to them to kind of lower that concern?
Well, again, the question is about the risk to the community, and as I mentioned earlier, and as I again would reiterate, the risk to the general community about this particular process is zero. I mean, because of the resources that have been brought to bear to ensure the safety of these individuals are brought from the airport to this facility, again, there is no risk to the general population, and I emphasize that as much as I possibly can. I think if we look at the overall risk to the U.S. population, we look at this novel coronavirus, COVID-19, as an emerging virus that we are learning more about. And I think until we know more about it, the CDC, Department of Health, has stated that the risk to the general population is low. It remains low, but again, we know that we see numbers across the world, especially China, that have continued to escalate, albeit they seem to be slowing down, which is a good sign. But nonetheless, we see a number of countries that have had diagnoses, and so the potential exists for those individuals to come to this country, so the risk does exist, albeit very low at this time.
Question?
Clarification point, I know last night we were told it was 5 patients and that changed to 4. Just curious why that was the case, and then also just to confirm, these patients are part of the 15 identified by the CDC, correct?
Or are they in addition?
Or yeah.
I don't have specific knowledge I don't know what 15 you're referring to. We were notified originally that we would receive five patients, and then last night we were notified by Health and Human Services it would be 4.
They're coming from Travis Air Force Base. How did they get to Travis Air Force Base? Were they infected in California or were they infected abroad?
I don't have specific knowledge to that.
How are the patients being transported from the airport to the hospital?
They were transported via ambulance with our Spokane AMR team, which is a team that trains with us regularly, and they train regularly on their own as well. So they're highly capable and have these processes down.
Now, within those ambulances, is there any kind of sanitizing that they have to do within it after they were transported?
Yeah, they follow the disinfection practices that are in alignment with CDC guidance for this virus.
And can we expect any type of regular updates, or will they be posted online, or how will we know moving forward kind of what the status will be?
Yes, we'll be coordinating that with the Spokane Regional Health District, and we will have regular updates for you each afternoon.
Thank you.
Just to be clear, so you could take 6 more patients from now at what our pathogen unit can contain. And I also wanted to confirm that these patients are not coming from that cruise ship as well.
I can tell you I can confirm we have 10 beds in that unit. And as I mentioned earlier, we would do a risk assessment based on the patient's condition of how many patients we could care for in that space.
Okay, we have time for about 2 more questions.
I know, again, just to reiterate, you guys have said that the risk to the public is 0, but we've had some people commenting on us, sending us messages asking, they're considering moving hospitals because of this. What would your advice be to patients that might be considering a different hospital for treatment while this is happening?
You want me to take that one? I realize to our community, this seems unusual. And as Dr. Martz mentioned earlier, and Dr. Lutz as well, we take care of infectious disease processes at Sacred Heart, at Holy Family. Deaconess does, Valley Medical Center in the Valley does as well. Caring for people with infectious disease is not new to hospital care teams. And the fact of the matter is that the capability of our teams to be able to care for all who are in our hospital today, who might come tonight or might deliver a baby, maybe even tomorrow, is that we know that they will be safe. And we're intent on that promise to our community. Thank you.
One more question.
And so just the people that are kind of helping work on these patients, I know they're going to be under some kind of quarantine or structure to keep them safe. Can you kind of elaborate on what their kind of daily procedures will be like while caring for these patients?
They will be following the personal protective equipment guidelines and our specialized processes within the unit that are in alignment with CDC guidance that will keep them safe. So we're confident in our processes, in our expertise, and in the training that we've done. And this is what they do. This is what they've trained to do.
Thank you very much for your time today and for your questions. And that will conclude today's news conference.